Next to the fingers, the forearm is probably the most versatile tool we have at our disposal. It's extremely easy to use. Actually, it's much easier than using the fists, the knuckles, or even the fingers. And it's an easy way for you to take care of your body, and it also feels very supportive for the person you're working on. I'm going to start with the legs to show you some of the ways you can use the forearm. In areas that are bony, like the front of the tibia, you can use the fleshy part of your forearm. And I don't have to have my arm up in the air. I can very often just rest my hand wherever it's comfortable and then do a snow plowing stroke up the leg. Any area where there's bones, you're not going to want to rotate your arm because your ulna would be pressing against that and it would be too sensitive. You don't have to always go in a straight line. You can use your hand right here as a pivot point and work at angles to sort of pull this tibialis anterior away from the tibia here. My biomechanics are not going to be perfect here because I'm trying to keep my body out of the way, so I'm actually reaching across the midline, which is a little strain on my back, but it'll be easier to show you what's going on here with my forearm. So with a large muscle group such as the quadriceps, you may want to rotate your arm slightly so that you have the use of that ulna to sink in a little deeper. If you start noticing that your client is reacting to the pressure and it's a little too much, you may not need to move out to a more superficial level. You may just need to rotate your arm a little bit to have a softer surface, or slow down. Notice that my wrist is relaxed. There's a very different feel to this stroke if you tense your wrist. That tension is going to go all the way up your forearm and it'll have a very different feel for those muscles. So let your hand just swing relaxed. A couple other points on using the forearm. You want to make sure that you're using it near the elbow. As you move farther and farther away from the elbow, it requires more and more muscular force to hold everything. I don't know if you can tell with my shoulder here, but I'm having to use my shoulder again to supply force. So the closer I am to the elbow and the lever arm of the humerus, I'll have a lot easier time of it. Sometimes people, if they feel like they're working a little too hard and they're not quite strong enough, all you need to do is take your other hand and brace your elbow, and that'll provide support for you. I'm going to move Dina's knee up to show a way of working on the IT band with the forearm. Again, this nice, soft, fleshy surface of your underarm is probably the best way to do this. You can provide more and more stretch the more that you bend her knee over. And just do a raking stroke, snow plowing. This is something you want to be a little careful of if somebody has some low back issues. You can be rotating the spine a little too much. And we'll talk about working on the IT band in the side lying position later. But this is an excellent way if you want to take a couple quick strokes down the IT band to work this. Another disadvantage working this way is that you are compressing this femur into the acetabulum here. So we'll talk about a couple other ways of working on that. Yes, indeed. We will actually show working on the back right now. I know we've been doing a lot on the legs, so let's use the forearm on working on the back. The important thing on the forearm and the back is that you want to have your elbow toward the spine. If I use my right hand here, I wouldn't have any specificity close to the spine to be careful about where I'm actually applying pressure. So let me finish this stroke and show you what it would look like if I used the right hand. So if I use the right hand, you can see I really can't get close to these erector muscles and try to push them one way or another. I can basically just do a nice broad stroke up that way. This is fine, but if you want to get specific, you're going to need to use your arm so that your elbow is near the spine in what I call the spinal groove, the area between the transverse processes and the spinous processes of the spine. Depending on how broad or narrow you want your stroke to be, you can raise your arm. The more you move up toward the elbow, the more specific you can be. Regardless, if you're taking a very long stroke, you're going to want to swing your arm around so that you're not sliding over the prominences of the scapula here. And then you can follow all the way up and finish off on the trapezius here and the levator scapula. Remember, don't get too hooked into doing a long, continuous stroke. It's fine sometimes, but if you feel particular tension in one area, come off and do repeat strokes. Sometimes just waiting for that to soften, sort of jostle the body a little bit. Feel if these ribs are giving on the way up. Start thinking about the bony articulations here rather than just the superficial muscle. Coming down on the other side, I can pretty much duplicate the strokes I was showing with the fist by using the forearm. If I want to get more and more sharp, I just raise my hand and pretty soon I'm going to be working with the elbow, which we will be showing next. Another advantage of working unilaterally is you can take your other hand and push down the shoulder and get some strokes right along levator scapula and the trapezius here. So we're putting those on a stretch actually. And of course, the same area that we talked about with the fist, you can also use your forearm on the scapula and on the rotator cuff. After we finish the elbow, we'll have all the tools at our disposal, and as soon as you're working some way and your weight isn't right, or you want to use a little more direct force or a little less direct, then you'll have anything from your fingers all the way up to your elbows to use. I'll be talking about the side-lying position later in this tape, but I think it works best to have Dina in this position now to show one other great way to work with the forearm. And that is, in the side-lying position, I can do a wonderfully broad stroke all the way down the IT band. I can distract this leg so that her femur almost drops right out of the pelvis. And this is a great position to work with the forearm. Notice again that I'm working up near the elbow. I'm not getting down where the rest where I would be straining. And just stroke down and just gets a lengthening stroke the whole way here. I can certainly start raking across the gluteals and change my stroke if I'm feeling some tension here and change directions here. The crest of the ilium is another area that is often neglected, and it feels great to use a forearm here. You have a nice soft part of your forearm. You would not be using the bony part of your ulna here. So all I would do is move over. I'm going to try to keep my body out of the way so my mechanics are not perfect, and just work along the crest here. You'd be taking care to not use your elbow in this area because the sharpness of the elbow would not feel good on that bony surface of the crest. But a nice broad forearm is perfect for this area. As easy as the forearm is to use, the last of our tools, the elbow, is probably the easiest. Basically, I'm going to keep this pretty short and pretty quick because we'll have ample examples of the proper use of the elbow when we start talking about specific ways to work on the body. I'm probably going to retrace some of my steps on the back that we used with the forearm and just show you with the elbow the basic difference. Forearm would be nice and flat and relaxed. Elbow, you just bring it up, and you can use, depending on how you rotate, you can use as much bony surface as you can. You want to keep away from getting on the uphill side of your elbow where the ulnar nerve is. You can irritate your elbow there. So do most of your pressure down below the elbow and just work your stroke slowly, sink in, grab that tissue, pull the tissue rather than sliding over it. Some people are going to have very, very bony backs without a lot of musculature, and you feel like you're sliding over that. When that happens, all I do is take my other hand right here, put the elbow in the crook of the thumb, and then that's going to keep me from sliding. Remember when you're working down the back that the floating ribs down here are not going to take nearly as much pressure as the upper ribs. And this might be a reason to sometimes use the elbow because you're going to have less surface area than you are with the forearm, and you're not going to be disrupting large patterns of ribs here. You can work very, very precisely. Another example of where the elbow is very, very effective is when you need very focused work in one small area. A lot of people are very tight and fibrous at the ischial tuberosity where the hamstrings attach. So all I'm going to do is keep my hand here so my elbow won't be sliding over the tissue, which can roll here just distal to the ischial tuberosity. And then just pretend I'm grabbing these tendons, waiting for them to soften. That feeling of softening tissue, including tendons, is what we're really working for in deep tissue work. And that's why you work slowly, so that you can feel this tissue softening. Sometimes you can wait for a minute or so before you feel this tissue finally letting go. And what I find is that if the tissue doesn't let go, very often it's that I'm pushing too hard rather than not pushing hard enough. The body's reacting against that pressure. Another way to save the thumbs, the elbow is a great tool on the bottom of the feet. You can get very, very precise with your elbow, and you can really feel what's going on with your elbow. I'm sure that my elbow is more sensitive by a factor of 2 or 3 times than my fingers were when I first started doing massage. All I need to do is hold this foot so I can manipulate it, come in with my elbow, and start stretching that plantar fascia. This feels very, very good. It's a broader surface than your thumbs. Sometimes people that are ticklish with thumbs and finger work on their feet will be able to take the elbow. You can even move to the forearm if you want a little broader stroke. This should do it for the elbow for now. We're going to have lots of uses for it later. It's actually very, very easy, and I find that most students really have a pretty good grasp of this. Now that you know how to properly use your fingers, knuckles, fists, forearms, elbows, and you have proper biomechanics, and you have the idea about sinking into tissue and grabbing tissue, I want to talk about several different kinds of strokes with a little more precision than what I've been talking about earlier. Earlier I need to really focus on how you're properly using your body. Now I want to talk about accomplishing something. A stroke without intention can be an empty gesture. And I want you to really remember that, because I've had a lot of massages in my life that have been done with great flourish, and they haven't accomplished much. And you can tell that people are focusing on the strokes rather than what they're trying to accomplish with the body. So I'm going to give a few different kinds of strokes here that will have precision in what your goals are so that your work becomes much more effective. The first type of stroke I'd like to demonstrate is the basic lengthening stroke. We're going to talk about different kinds of lengthening strokes later on, but the first one is the basic stroke most people learn in their first massage class, which is an Esalen stroke. It comes by many names, but basically you're going along the muscle fiber direction. You could switch to any tool you want to use now. You can use the forearm now. If I wanted to, I could use a fist. All of the time, I'm going in the direction of the muscle belly fibers. I'm not going to cross over the knee yet. It's too sensitive an area to really accomplish much in there. You need much more precise work. If I wanted to work with my knuckles right along the Achilles tendon, I could work in the same direction like this. Moving up to the hamstring, same idea. I often like to use broad surfaces like the forearm on the hamstring. Fist here, there's a tendency for those muscles to roll around the bone and you just don't have the stability. So I use the forearm a lot of the time here. Notice that I'm taking my bottom hand and I can turn the leg, I can stabilize the leg, and I can distract the leg. We'll talk more about distracting joints later on. The erectors, again, are the area that so many people are tight in, so the same thing. Basically, I'm going to run up the spine with the erectors here. I can do repeat strokes. I've demonstrated the use of the forearm in this area already. So let's demonstrate the knuckles to show how to save those thumbs. Triceps all the way down to the hands. Anything on the arm. This time you'll notice I'm not working toward the heart. A lot of classes really, at least in the early going, talk about the importance of always moving toward the heart. I believe there's a lot of times if you move nice and slowly that the cue that you're giving this arm to relax and drop out of the glenoid fossa there so that the shoulder isn't jammed there far overrides any possible benefit of moving toward the heart. By the same token, I can come this way and work on the forearm, anchoring here, and give the cue for this elbow to relax and distract, not be so compressed. These are your basic lengthening strokes. One of the things that we need to work with as massage therapists is to decompress joints rather than just stretching muscles. So I often try to think about working across joint lines so that I can give a cue to the body to relax a constricted joint. The hamstrings here will be a perfect example of how I can work to decompress the hip joint. A lot of people, if they're doing impact sports, landing with basketball, running, things like this, the hip joint gets compressed and every step you take it's pushed in. So I often like I'm going to work across Dina's body so you can see what's happening. My mechanics aren't great because I'm leaning a little too far forward. But what I can do is I can distract Dina's leg. So basically I'm pulling her femur a little lower in the acetabulum here and then working in a stroke to lengthen this muscle in that same direction that I'm lengthening here. So I'm working in the same direction that I want to give her the cue to open up that muscle. And there I felt her femur just drop, just a little bit, a nice subtle relaxation in the joint there. The lower hamstring and knee also works to show the same principle but working with a slightly different stroke so that you can get an idea how you combine these different principles. If I want to decompress a knee, I certainly could do the same thing by working on the gastroc and pushing down this way while anchoring away in the opposite direction up here. Or if I want to stretch the hamstrings in the opposite direction, I just grab her tibia here, get a nice soft hold here, and then distract this joint here and move up this way. You can do this anywhere on the body. You can distract the shoulder joint by gently pulling the humerus away. You can distract the ankle, you can distract the wrist. Any of these are great ways to give the person a cue to have a looser joint. You can do the same thing on the quadratus lumborum here. I can take my hand and get a little bit of a hold of her quadriceps here and her femur and pull this down. I can even move her legs over a little bit to pull this hip joint away from the ribs here and stretch the quadratus. I could work with knuckles, I could work with fingers. I personally like to work with fingers here. You're not going to use too broad a surface because you have the floating ribs and the kidneys here. You want to have your force in a fairly small surface area. Dina's foot and ankle complex illustrates another important point that is not often covered in massage classes. We often try to extend a joint and make for greater range of motion, but some joints are unable to shorten properly. If you look very closely right around here, and when I have Dina dorsiflex her foot, you'll notice a little bit of jerkiness. It's almost like it's catching as it's shortening. So Dina, if you flex your ankle up, okay, it's not a very smooth movement there. So all I'm going to do is, instead of spending all of my time trying to just lengthen this foot, Dina's a swimmer and her foot often is very extended, so she has great range of motion on plantar flexion here. Her dorsiflexion is a little bit limited and she's not used to moving her foot that way, so I just sort of look like when the dog is screeching to a halt on the rug, that it just sort of buckles.